is low. It's up to 80 to 90% risk reduction. So your risk is almost like somebody that has never smoked. So that's why, again, smoking cessation is a very important concept here. All right, so we want to talk about the barriers to lung cancer screening. There are a lot of barriers here. I'm going to start from the top left here, lack of awareness. Well, that's why we're having this event. Okay, so lung cancer is the killer of women. You know, it's the number one killer of women in terms of cancer. So we need to make sure that everyone knows that we should be screening patients. If you're high risk, we should be screening. Cost concerns. Well, some people say, oh, you know, I can get coverage from my insurance and all of that. Franciscan has made a very wonderful, you know, promo scan. They have a $49 scan that combines the lung and the heart scan every year. You can get that very cheap. Skepticism regarding the evidence. I mean, I'm here to answer all your questions, but again, we have great evidence, 2 large trials that show that when you screen patients, high-risk patients with that are at risk for lung cancer, we're able to detect cancer early, you know, and when you detect it early, you're able to treat early, and they have a better outcome. And those studies show that we have a 20% reduction in lung cancer mortality when we screen patients. On familiarity with guidelines, and we just talked about that. That's what the US guidelines are saying. If you're age 50 to 80 years old, we should be screening you and all of that. I'm here to answer any questions about perceptions, fears, stigmas, you know, around lung cancer screening. Some people talk about radiation dose and everything like that. So just for context, everybody is exposed to some kind of radiation, background radiation in the US. You know, we measure this radiation in millisieverts, and everyone has about 3.1 millisieverts exposure to radiation in the US every year. The low dose CAT scans we use is 1.5, so it's way lower than that. Okay, 1.5 millisieverts, and every year you get this scans, so way lower than the background radiation everyone is exposed to. It's low dose. If you were getting a regular CAT scan, that would be 7 millisieverts, so that's higher, but we use a low dose scan for this, so the radiation exposure is pretty low. Identifying eligible patients, we talked about that. Access challenges, and Franciscan is doing a good job, you know, in creating awareness to make sure that everyone has access to lung cancer screening. We always do this before we screen. We always like to bring you to the clinic, you know, and talk about shared decision making. We talk about the risk, the benefits, you know, of lung cancer screening, and when we get or when we find a nodule, you know, what's the probability for lung cancer? Do we need to biopsy that and all of that? So that's something that when we see you in clinic, we talk through with you. And then we talked about managing abnormal results as well.